In the International Myeloma Workshop in New Delhi in India, we had the first report of a very important study regarding bone disease in myeloma. We had the comparison of zoledronic acid, which is a standard of care, with another bone-targeted agent named Denosumab, which is an anti-rank ligand monoclonal antibody. This was one of the largest studies in the field of multiple myeloma, with more than 1,700 patients who were randomized to receive either denosumab at a dose of 120 milligrams subcutaneously every 4 weeks versus zoledronic acid, the standard dose 4 milligram every month, every month. This study is very important. It was a double-blind study, so it included placebo in both arms, and there was also stratification regarding autologous transplantation or not, regarding the induction treatment with a novel agent-based treatment or conventional chemotherapy, and also regarding the different regions and the stage of the disease, ISS1 or 2 versus ISS3, and Japan versus other regions. So I think it is an important study. As I told you, more than 1,700 patients, and the results, first of all, was that the denosumab was non-inferior to zoledronic acid. This was the primary endpoint of the study that was achieved. And we had two very important findings, I think. The first finding is that there was a PFS advantage in favor of denosumab, with a hazard ratio of 0.82. So it means that approximately 20% of the patients have a progression-free survival advantage for denosumab arm, and this is very striking. There was no difference regarding overall survival between the two groups, and this is important because some years before there was another study which showed, a small study of course, which showed that possibly zoledronic acid patients have a survival advantage over denosumab. And the other important issue had to do with toxicity. So patients under denosumab had very lower renal toxicity compared to zoledronic acid, and especially those with a creatinine clearance between 30 and 60 ml per minute, because below 30 it was not permitted, it was an exclusion criteria due to zoledronic acid toxicity. But for this specific cohort of patients with creatinine clearance between 30 and 60, the adverse events, the renal adverse events, was 26% in the arm of zoledronic acid versus 13% only in the arm of denosumab. That makes us feel much better when we have a patient with renal impairment, which is very, very often in multiple myeloma era, to give denosumab. So if we put all these together, meaning the very good efficacy in bone disease with very good renal safety and the prolongation of PFS, I think that all these make the new drug to be very interesting for the treatment of myeloma. I believe that because of this study, the drug could be licensed for the treatment of myeloma bone disease, and I think that it's going to be another important drug for the treatment of bone disease in myeloma.